State health officials announced today 339 new COVID-19 cases and
we will get right to the questions, but before we do that, we'll go right to Dr. Box. You've got some significant, meaningful updates on both numbers and some testing.
Absolutely. Thank you, Governor. Good afternoon, Hoosiers. Today we reported 339 additional cases of COVID-19 in the state of Indiana, which brings our total to 38,337, the total number of Hoosiers known to have COVID-19. We also saw 15 additional confirmed deaths here in our state. To date, 2,173 Hoosiers have died of COVID-19, and an additional 182 are believed to have died from this disease based on their clinical diagnosis. Our ICU bed and ventilator capacity are holding steady, with 38% of the ICU beds available and nearly 83% of ventilator beds still available. We have also seen more than 320,000 Hoosiers tested for COVID-19, up just nearly from 278,000 a week ago. We've tested nearly 42,000 people through our statewide testing sites. To continue to maximize testing capacity and to address our plan to test employees at all long-term care facilities by the end of June, I want to provide two updates to our current testing strategy. First, as Indiana continues to progress along its roadmap to safely reopen, the state has partnered with Eli Lilly and the Indiana Hospital Association to launch a lab testing network to increase its daily COVID testing capacity. The network will initially be comprised of 10 labs located around the state, including the Indiana State Department of Health lab. A number of these labs are currently performing testing for COVID-19, but their testing capacity is limited due to the lack of testing reagents and equipment. To establish a competitive foothold in the international marketplace, allowing us to vie for testing supplies and equipment, the network will leverage the state's buying power to more efficiently compete for supplies, equipment, and for reagents with both the national and international manufacturers of those items. To launch the lab testing network, the state successfully placed approximately $60 million in bulk orders of testing reagents for use by the participating labs. The labs will in turn purchase their reagents at cost from the state. Once these reagents begin to arrive in early July, the state will double its current testing capacity. In addition to purchasing reagents, the state is also working and partnering with labs to purchase additional testing equipment or machines to allow for continued testing growth. This will allow the state to diversify its testing methods in case supplies of reagents for one particular system are in short supply. By having machines that use different reagents, we will be able to continue to test in high numbers. Due to global supply chain constraints on the equipment, the second phase will begin in August. As testing capacity continues to increase statewide, the Indiana Hospital Association will work with its members and other healthcare providers to increase the number of testing sites. I'm incredibly excited about this opportunity and am so grateful for the partnerships that are making it possible. On another note, today we started our work to test more than 57,000 staff members in skilled nursing facilities across the state by the end of this month. As you all know, COVID-19 has taken a terrible toll on our most vulnerable residents in our long-term care facilities. Our strike teams have been testing residents all along and will continue to do this. But we know that many of the outbreaks in these facilities started when a staff member who had no symptoms unknowingly brought the infection into the particular facility. Testing is a key component in reducing asymptomatic viral spread. That's why our strategy focuses on testing all staff of these facilities. This is the largest testing operation the state has done during this pandemic. We are testing staff from a total of 520 skilled nursing facilities. To determine how to best do this, we asked facilities how many employees they had and whether they were able to test and wanted to test their own staff if we provided supplies or if they needed further assistance in the form of on-site testing. Then we developed an approach that we believe will enable us to test all staff members in skilled nursing facilities by the end of this month. To make that happen, we are transitioning our Optum Serve testing sites from 11 of our counties to become mobile sites for the next 3 weeks. These sites all had lower testing numbers, so we believe that we could better use these resources by engaging Optum in the long-term care testing and making these mobile sites. This effort will be a hybrid approach. Today, through June 22nd, we are delivering testing kits to facilities so that they can take their own swabs. Optum will be on site to register staff and then transport swabs to their lab for analysis. This will be our approach for about 440 of the facilities who preferred to do their own swabbing. From June 23rd through June 28th, we will be doing on-site testing at about 60 of the facilities that said they preferred this approach. Because we are using Optum to help get this testing done, we are working with our local health departments to ensure that other testing is available to residents in the 11 counties where we removed these sites. This may include providing kits to the local health department or directing residents to other nearby testing sites. As always, any Hoosier can visit the testing site map at coronavirus.in.gov and find the location nearest to them, and we encourage you to do so and to help us continue to slow the spread of COVID in Indiana. Before the governor walks us through stage 4, let's review those 4 guiding principles that we have let direct us from stage to stage. Those 4 principles include monitoring the number of hospitalized COVID-19 patients, retaining the capacity to treat the surge of patients, having the ability to test all Hoosiers who are COVID symptomatic, and having the ability to contact trace all of these positive cases. As you can see, we have continued to see a decline in hospitalizations from May 11th, where we had 1,346 COVID-related patients in the hospital, down to 902 on June the 8th. We have also seen hospitalizations admitted per day decline from May 8th until June the 1st. Our ICU bed availability has remained very steady, somewhere between about 37 to 38%, up to about 42 or 41%. And our statewide ventilator capacity has remained very stable. The ability to have an individual on a ventilator if needed is very stable. Already, Indiana maintains the ability to test any and all indicated patients for COVID-19, with that capacity increasing with our reagents and almost doubling with the order of reagents. We will certainly be able to maintain that. And lastly, we have the assurance that we are able to contact trace any positive case to help those individuals to isolate and then to determine any close contacts that they've had so that we can quarantine those close contacts. So, Governor, the data looks good for now.
For now, underscore for now. I love it. Well, and the reason is because Hoosiers have, I think, for the most part, been very not only patient but vigilant, and that is that combination has allowed us to weather this storm and continue to progress from stage 1 to stage 2 to stage 2 to stage 3, and now on to stage 4 in our response to this unprecedented virus in our lifetimes. And so thank you. First and foremost, as we look to the next stage, that being 4, because of the trend lines that Dr. Box just talked about, progressing hospitalization rates, the availability of ICU beds, the availability of ventilators, and our tracing and testing capabilities as they continue to expand and cover. We will be able to advance to stage 4, and we'll be able to do it earlier than we anticipated. I always like to, about midweek, project or forecast what we're looking at for the next week in terms of going from one stage to the next. But as the numbers hold, and because we do look good, we'll push back stage 4 or pull up stage 4 to this Friday at 12:01 a.m. For all counties in the state of Indiana can be able to join stage 4. So it's, again, 12:01 a.m. Friday morning instead of June 14th as was originally written in our posted Back on Track plan. I will ask Dr. Box, if, as I go through this at the tail end of that, if you would talk just a little bit about what we're seeing in up in northern Indiana and in a couple counties, Elkhart and LaGrange counties, just want to make sure that we're mindful of that. Obviously, we're working hand in glove with the local communities there as well, but a couple cautionary yellow flags. Still moving forward, but just a couple counties if you'd elaborate on. There aren't that many substantive changes if you were looking at the Back on Track plan online in terms of stage 4. We just have moved it up. Social gatherings will go up to 250 people, up from where we were. Restaurant and dining facilities will be open to 75% of their capacity. Bars and nightclubs up to 50% of their capacity, again, while maintaining the physical or the social distancing, all those precautions still in place. Retail, stores and malls are open at full capacity come this Friday morning. Cultural and entertainment tourism sites such as museums and zoos and aquariums are all up to 50% of capacity, open for 50%. Movie theaters, bowling alleys, open at 50%. We are going to have more details on community youth and adult recreational sports and leagues and games, tournaments. They will be resuming, but we will post more details on this line item tomorrow by noon inside that executive order that will be posted by noon tomorrow on Thursday. Amusement parks and water parks open at 50% capacity come this Friday. Water parks, I've got my Holiday World mug here with me today. Also, in addition, our auto, we're a state that likes to race and set the pace, and so our auto and our karting and our bike racing venues will be open at 50% capacity, again, while maintaining the proper physical and social distancing. Parimutuel horse racing also can begin this weekend with no spectators out at Hoosier Park and the Indiana Grand facilities. Charity gaming and casinos will be open on June 15th. So that is next week, June 15th, Monday at 6 a.m. Each of those facilities, that went through the Indiana Gaming Commission, and all of the facilities submitted plans on how they would open safely. Those plans have all been submitted. The Indiana Gaming Commission has approved all of them as of today, so they are on track for their own timelines come next week. Professional office settings are open at full capacity. And again, I just want to stress all of these changes, all of this progress is with consideration that social distancing, physical distancing, all those practicing safe hygiene are in place in the plan of that particular venue. And then stage 5, I mean, if we stay on this track, then come Independence Day, July 4th, we'll be looking at festivals and fairs and parades and carnivals that still are considering being open, but for the time being, they're closed until stage 5 gets here. Playgrounds may reopen. State government buildings will be all open per appointment. And again, social distancing, safe hygiene practices, Hoosiers 65 and older or have these underlying health conditions, that whole list of cautions, we ask you to keep those in mind. Face coverings are, again, recommended, underlined recommended, as we continue to not just open up, but progress. And Dr. Box, if then you would talk about, you've got a few other things to talk about, but if you would highlight LaGrange and Elkhart counties just so folks know where we are.
Absolutely. Thanks, Governor. I really want to emphasize what the governor just said, that as we move to stage 4, it doesn't really mean that we go back to the normal. No masks, no social distancing, no careful hand washing, alcohol in your hands. All of those are critical. Wearing that mask is important. It's especially important for our very vulnerable residents, and your wearing your mask helps to protect them, especially our individuals over the age of 65. I'd like you to continue to practice social distancing as much as possible and to limit your excursions. Have someone shop for you, order online, wear a mask when you do need to go out. No matter what your age, please continue to take precautions. I also want, as the governor mentioned, to mention Elkhart and LaGrange counties. We really believe that they can move forward at this time. Again, we have been in very close discussions with their commissioners, with their local health officers, and also with the other individuals very active in their communities. And we realize that there have been an increased number of cases there. We have talked to them about those cases. Those cases tend to mirror the increased testing that has been done. But specifically, we may need to do some targeted testing in specific populations in those areas. Most importantly, and the thing that was probably most concerning, was that I did see a slight increase in hospitalizations in LaGrange County. Now, if you look at the region overall, they still are very stable on their available ICU beds and very stable on their ventilators. So there's a lot of capacity in that region. But it does bear watching, and the local health officers and their county commissioners have the choice to make different choices or to be more restrictive than we are. But at this time, those would be the cautionary things that I would bring up. And lastly, as parents, I want to make sure that as you take your child back to the playground, that you do have some continued precautions. Carry that hand sanitizer along with you. Encourage your children to wear masks if they can, especially if they're on the merry-go-round with another 5 or 6 kids. Encourage them to social distance, but I know they're probably not going to do that very well. Avoid feeding them when they're on the playground. Make sure that if you do, that you give alcohol their hands. And when they do get home, make sure you wash their hands really, really thoroughly. Maybe even change their clothes at that point in time, because they're probably going to be a mess anyway. But just practice some very careful things, and you should be fine with your children at that point. Thank you so very much. We still want, COVID is still out there, so we still want you to be very careful and keep you and your family safe.
Rachel, with that?
Brandon Smith, Indiana Public Broadcasting.
Good afternoon, Brandon.
Afternoon, Governor. I was hoping to ask about right now the eviction moratorium is scheduled to end June 30th. One, are you planning to extend it further? But two, what specific resources is the state directing to Hoosiers who need help paying their rent to avoid essentially what advocates are calling an eviction cliff when that moratorium is lifted?
We are, Brandon, looking at both points that you bring up. Our housing IHCDA is working on something right now, a program right now. Kudos to Marion County for putting something out as well. But the state is looking at not just Marion, but 91 other counties. And we should have an update on that next week. We are working on that right now. In terms of extending the eviction clause, that's still being discussed. An update, though, Brandon, for you next week.
Blaine with WEVV.
Good afternoon.
Good afternoon, Governor. Obviously, we're reaching stage 4 2 days earlier than expected, and stage 5 is set for the 4th of July. Do you feel the trend is continuing for the numbers to be more positive, that we may reach stage 5 earlier than the 4th of July weekend? And also just how encouraging is the numbers, and just be able to open up the state a little earlier than expected before the weekend rather than during the weekend?
Well, first things first, we put a lot of work into not just looking into a crystal ball to be able to and have the confidence, and it's just the facts, it's the numbers, it's what the data, that's what is guiding us. And so as optimistic as we are about the next 24, 48, 72 hours, 96 hours, I don't want to predict 2 weeks from now. We need to see, and by the way, this should be, we're reminded we're not alone in this. And so when you look around the country and you look at some states where the numbers are trending down in a very positive direction, like in the state of Indiana, other states they're trending up in the other direction. And so you wonder what happened with the virus. What is the virus? How is it mutating, if that's the correct medical word, or what happened during Memorial Day break in those areas. And so there's too many factors to project probably more than 4 or 5 days, let alone for 5 weeks. You want to comment on that? Caution as well, because we're seeing in different parts of the state. Now, what I will say, and then I will turn it over, I promise. What I do think that this illustrates, or underscores for me at least, is we made the right decision early on to hit pause. And that's when I said, thank you, Hoosiers, for your patience and your vigilance. I mean, we hit this hard at the outset, and we are in a better position today because of that. I am absolutely convinced, because of the way Hoosiers responded, we are able to move up a couple of days. It could be a tale of two different cities here, and we could be in someone else's shoes. And so we can't, as Dr. Box said, we can't let up. We can't act like this virus isn't continuing to spread across the state of Indiana, but we have the intensity at a managed level.
I agree with the governor wholeheartedly. I don't want to predict where we're going to be 2 weeks or 2.5 weeks from now, but our numbers do look really good right now, and we will continue to look at the state as a whole, but also look at individual counties and individual regions, because we want to work with them and make sure that they are doing and we are doing what's the safest thing for their communities also.
Tom Davies, The Associated Press.
Afternoon, Tom.
Hello, Governor. Were there any COVID-19 infections found among the National Guard troops that were sent to D.C., and why do you think that was an appropriate use of those troops, and are you continuing to keep any troops out in public in Indianapolis for any protests?
We're definitely on standby here in the state of Indiana. Yes, I do. We have never in the history of the state, I asked, turned down a national request. They are the National Guard. We haven't turned down a national request. They were guarding property for a very limited amount of time, but they're all back home in Indiana, completed that duty. And yeah, now in terms of the testing on National Guard troops, we haven't tested any symptomatic troops.
We have not done any testing, mass testing of National Guard. General, did you want to say something? I see you standing up.
You want to talk about, General, just when folks returned home, because they were in a couple different waves, and how proud we are of them for their service?
Thank you, Governor. Brigadier General Dale Isles, the Adjutant General, Indiana Army National Guard. Yes, we deployed soldiers to the National Capital Region to assist the Metropolitan Police in their efforts to provide public safety. All of those soldiers are back to Indiana now, and they have gone through a process of demobilizing, and we have tested them. We haven't tested them, but we have monitored them in accordance with the CDC guidance to ensure that they don't have symptoms for COVID. And they are now out processing, and everything looks good, and we have no COVID positive soldiers in our ranks right now.
You want to talk about the posture that you're in right now in the state of Indiana?
Yeah, so right now we have a very small contingent of National Guard soldiers that are training as part of a National Guard reactionary force, and we are working with Superintendent Carter's folks to ensure that we have the right amount of forces available to assist Metropolitan Police, local police officers, and the Indiana State Police if necessary.
Thank you, sir.
Elizabeth Binion, WNIT Public Television.
Good afternoon, Elizabeth.
Good afternoon, Governor. I have two questions, probably both for Dr. Box. The first is that public health officials have encouraged protesters and others who have been in close quarters with people, particularly if there's been shouting involved, to get tested for COVID-19. How long should people wait before going in to get tested in order to minimize the possibility of a false negative? And secondly, the World Health Organization recently announced that there is a very low risk of transmission from asymptomatic individuals. There's been some controversy about this. I wonder how, if at all, this announcement shapes your approach to containing the virus here in Indiana.
First of all, with regards to the protesters, we did some downtown testing over the weekend on about day 8 of the protests. I would say that there's not a specific length of time. If somebody becomes symptomatic, they should get tested, and there's testing available all over. Any individual who has been engaged throughout this 8 to 10-day period certainly is in that window to get tested and could go to get tested for free here in the state of Indiana at any of our Optum sites. I was pleased with the 400 individuals that got tested over the weekend on Saturday, that many of them were wearing masks, so that was good. Even though they may not have been social distancing, they were oftentimes wearing masks and hopefully washing their hands and alcoholing their hands. Oh, the second thing, sorry. The asymptomatic transmission, you know, the WHO walked that back, and I'll tell you why they did. At time 0, when we test someone who is asymptomatic and we do their test and it comes back positive, we don't know if that individual is going to stay asymptomatic or if they're what we call pre-symptomatic, meaning that within the next 48 to 72 hours, they may actually develop symptoms and really are more infectious. So when we talk about asymptomatic individuals, it's lumping together because we only know that one single time when they got tested that they were asymptomatic at that moment. You're lumping together asymptomatic, truly people who will never develop symptoms, and pre-symptomatic people who may develop symptoms and already could be shedding the virus.
But Elizabeth, this is, I've had many discussions since that comment was launched around the world. And I will just tell you, Elizabeth, this is why we are very careful to express facts and to share what is, not our editorial, not our opinion. This is what we are seeing, and this is what we're guiding, because I can tell you there's a lot of opinions out there. There's a lot of contradictory. One person says this, one person says something completely opposite. We're not going down those rabbit holes. We're presenting you with what is.
Sherry with the Indianapolis Star.
Good afternoon, Sherry.
Good afternoon, Governor. Good afternoon, Dr. Botts. Given that you were just talking about there's a lot of opinions out there of what is or what isn't, it seems that one of the things I've seen pretty unequivocally from health officials is that wearing masks certainly isn't going to hurt you, and it may actually help you and the people around you. Yet, whenever I am out and about these days, I am surprised at how few people are wearing masks and how many people I am seeing touching one another, hugging one another. And I'm just wondering if there are any plans to invest in a public service ad or any sort of campaign, any sort of messaging campaign, because my sense is that there's some people are getting it and a lot of people are saying, nope, this doesn't apply to me, I'm not going to do it.
Sherry, do not disagree with you. We did a lot of PSAs at the very beginning, Dr. Sullivan and myself and other individuals, and I'm not saying that we won't reinvest in doing something like that. The problem is there are some people, you're not going to change their mind no matter how much you talk to them. I mean, we've messaged this same thing every single day since we have started this process. We have written it in our documents and our guidance. We have messaged it through you guys in every way that we can. I'm not saying that there are not other ways that we can bring this up, but again, I really believe that the healthy young individual that wears that mask is really protecting those other individuals around them that might not respond well to coming in contact with that virus. So I understand what you're saying. I have the same concerns. I did see more people at the grocery store where I occasionally get to go to buy stuff, and I was surprised that the mask had increased, and someone in the store actually even stopped me and told me, hey, your message is finally getting through. But I think that a lot of our retail stores could actually take a stance on that and say, as I've said before, no shirt, no shoes, no mask, no service. I think that would be one way, because that's where I'm most concerned when we're inside and we're interacting in a real retail space.
Yeah, I don't think, Sherry, good point taken. I mean, we can't message enough, and as much as we did early on, that's not to say we don't have a updated stage 4 PSA effort as well, because it's just as important now. My concern is, as you said, we can't take anything for granted, can't take let our focus veer from what is happening on the ground today. And I just see other states around the country who are in a good position, and maybe it's hitting them later than it hit us in the beginning. But for where the cause is, I know you're right, Sherry, that better safe than sorry. I stopped in this past weekend in a Joann's Fabrics, and thankfully I was wearing my mask, and everyone recognized who I was, and everyone else was wearing a mask. So the word is getting out, but it'll never be enough.
Brock Turner, WFIU.
Good afternoon, Brock. How are you?
Good afternoon, Governor. I'm well. Good afternoon, Dr. Box. Question for you, Dr. Box. During a June 5th webinar with county health officials, ISDH provided messaging for localities not releasing COVID-19 data, specifically in their long-term care facilities. Other health departments and other local health officials have told me that they've received direct guidance from ISDH not to release that data. So I guess I'm just curious as to why and when ISDH gave those directives to local health departments not to release facility level data. I understand that ISDH is not doing that, but when were those directives given to local health departments?
Dr. Dan, you want to come up? To my knowledge, no one from the Indiana State Department of Health has ever directed anybody that they should not release their data. We have supported them releasing their data if they desired to release their data.
Yeah, I'm Dan Rusiniak, Chief Medical Officer for FSSA. I'm just going to echo that as well. None of the conversations I've had with them as well have we directed them to not release data.
Kayla Sullivan. Sullivan. Sorry.
Brock, you got a follow-up?
Yeah, sorry about that. So to the county health officials who have said like they've called into ISDH and asked that question specifically and said they've gotten directives to not release that, you're not familiar with anything of that happening and of that nature?
I am absolutely not familiar with anything like that happening.
Kayla Sullivan, WXIN.
Afternoon, Kayla.
Good afternoon, Governor. I have a question for you, and I have a question for Dr. Box. I'll start with Dr. Box. According to CDC data, some states, including Indiana, are not reporting probable COVID-19 cases despite recommendations from the agency. Why is ISDH not reporting this information to the CDC, and do state health officials keep track of this data right now? And then for my question for the Governor, today the Indiana Democratic Party chair asked you to stop paying OptumServe until the company meets the terms of the state contract. Are you considering this, and do you feel the company is not living up to what it promised in the deal?
Kayla, we do keep track of probable cases. They come in like our deaths. They may come in as a case report from an individual physician, and it may be a case where it's not a lab report that comes in, and if that is a documented case, then that will be a case that we put on our case list. But if they come in without a documented lab test, but the symptoms and the signs were appropriate and everything else looked like a probable case, then we keep track of that. We just, like most states, do not report that, and we just don't report it on our website. There's no particular reason for that.
We have a very good working relationship with Optum. We asked them, and they told us they could do some incredible work to stand up to 50 sites around the state of Indiana. Again, this has never been done before. They had a good experience in the state of California that we were able to look at and reference. And yes, we will continue to work with Optum, and we will continue to use them to test and get the results. It's helping us decide very important decisions that need to be made that are guiding our state forward. They're a critically important component to this all, not the only, but a component of it. And to think about what they undertook and went from 0 to 60 in about 3 minutes, and to work with us, to take our input, to look at those. You talked about the actual hours of discrepancy, hours. But we continue to work through this together. And by the way, other states are having much bigger problems than this. This is not a problem per se. This is growing pains maybe, and this is biting off a lot at the very outset, and I like where we are, quite frankly, right now, and I know that we'll continue to improve as we continue to expand together. You want to?
Yeah, absolutely. We set this up very quickly, stood it up quickly, had a kind of rocky start in some areas. Some sites took off well. Other areas we really had some issues and concerns about. We reached out to Optum's parent company and immediately had 40 additional nurses in the state of Indiana within 48 hours at each and every site, overseeing the site, retraining, doing different things. They have worked with us tremendously well in moving sites, in changing hours, in registering different individuals. And I would say that even though our turnaround time originally was much longer than what is in our contract, we are now down to, in the last week, over 90% of our tests being returned in under 48 hours. So they really are meeting their metrics now, and we really are working with them to repurpose certain sites that aren't testing very many individuals to allow us to have the manpower to get out there and do things like test all our long-term care facilities, test within industries or businesses where that is needed. So I'm happy to have that discussion with any of our legislators that have concerns.
Yeah, and they are, they're willing to, if we call an audible and we went to our armories to begin with, but we're looking at different sites right now. And, some contracts would say, whoa, we didn't agree to that, but they're working with us to better connect with and serve Hoosiers. So I like where we are. And matter of fact, I'm recommending them to other governors.
Thank you.
Rob Burgess, the Wabash Plain dealer.
Hello, Rob. Good afternoon.
Good afternoon to both of you. First one is for anyone, and then the second one is for Secretary Lawson if she's available.
She is not, but I can pass. She's on my Fave 5, so I can pass that word on.
Great. Well, you can answer this one too, I'm sure. With elective surgeries restarting and some reduced donation opportunities, the American Red Cross is reporting a blood shortage. What state or National Guard resources have or will be utilized to support blood collection during this time? And then for Secretary Lawson, or now for you, both my wife and I registered for absentee ballots at the same time before the deadline. She received hers the Saturday before the election, and mine still hasn't arrived. I know Marion County has experienced some problems with absentee ballots during this election, and given the problems we've seen in places like Georgia yesterday during their primaries, what will you do to better prepare to allow Hoosiers to vote absentee by mail during using paper ballots in the general election?
In regards to blood drives, the armories are available for that, and we work very closely with the American Red Cross to set the conditions to do that, and we will continue to do that while we observe social distancing and all the protocol requirements for the CDC.
Yeah, and I would just ask Dr. Kaufman, you want to share a few comments as well from what you're seeing and needing?
Hi, Dr. Mike Kaufman, State EMS Medical Director with the Indiana Department of Homeland Security. There always continues to be a need for blood, especially this time of year when we begin to enter trauma season, where we see a significant increase in the number of acute traumatic injuries. Our emergency medical service system is there to get those folks the immediate care they need and get them to the hospital. But once there, our trauma centers will need a continuous supply of blood to save these folks' lives. And as you've heard me say in many public safety announcements since the beginning of this COVID pandemic, giving blood is safe. The American Red Cross has taken special care to set up their testing sites, or their sites where you can donate blood, their donation sites, so that you can donate in a safe manner with social distancing and all the proper safeguards in place to keep you safe and healthy while you donate blood. So please donate. You can go to redcrossblood.org to schedule a donation time.
Yeah, and Rob, in terms of your second question, obviously the Election Commission is looking at all the lessons learned from the primary election lead up to the actual election day on June 2nd, but then the aftermath of the election in terms of how do we course correct not just absentee ballots, but also the in-person voting. So you'll have about a month leading up to various options to vote prior to Election Day, whether it be through mail. Having said that, I voted in person, and I was very impressed with the PPE that was not just there, but that was being used. It was a very safe option. But voting by mail come general will be a key component to this. And fortunately, we've now got months, plural, to prepare for what we know is coming.
Abdul Hakim Shabazz, Indy Politics.
Afternoon, Abdul.
Good afternoon, Governor. Good afternoon, Dr. Box. Governor, two questions for you. With stage 4, does Marion County enter stage 4 on Friday? Does it still have to wait a week? And this for either you or Dr. Box. Any word concerned that the protests we've seen over the past 8 days will contribute sort of a rekindling or a restart of COVID-19 cases across Indiana?
You want to take two first?
Abdul, yes, there's always a concern when we have that large a crowd without any social distancing, many wearing masks, but oftentimes many not wearing masks. That will be a concern, and that's why we are continuing to message the availability of testing. I know Dr. Kane in the Marion County Health Department has set up additional testing, opened back up the fairgrounds to try to make sure that there's plenty of testing available, and our Optum sites are willing to test all around the state any protesters or anyone that was engaged in large crowds coming forward.
And to answer your first question, Abdul, yes, they can. Obviously, we defer to locals. We have in the past deferred to locals in terms of what their timelines are or how stringent they are, but they can, yes.
Steve with KPC Media.
Hello, Steve.
Good afternoon. How are you doing today?
Doing well. Yourself?
Pretty good, pretty good. Two quick questions here. First, you mentioned LaGrange County, which is certainly in our wheelhouse up here in Northeast Indiana. You mentioned, I think it was specific populations with a large Amish population, and we've been hearing a little bit from the health officer here. Is that one of the populations that the state may be trying to do some of this targeted testing? And then just elsewhere in the region, Noble County, Kosciuszko County, Allen County, DeKalb County have also seen pretty sizable increases that we haven't seen in the past. Is there concern about elsewhere in the region here in Northeast Indiana?
The whole Northeast corner has been something that our data team has been working with me, and we've been watching very closely. Our team is actually having a meeting today with all of the counties up there that do have larger Amish populations, and actually partnering with the Indiana Thrombophilia and Hemophilia Society group here, because they have very good relationships and work with the population very closely. So again, the offering of testing will be there. We don't always have individuals take us up on that, but again, we have talked about larger gatherings that the Amish tend to have, which are faith-based gatherings that they have even when they have large weddings. So that is something that we just want to continue to educate and support with the availability of testing.
Matt McKinney, WRTV.
Afternoon, Matt.
Good afternoon. My question here, in a formal response to our station, ISDH said it does not have any documents that track nursing home deaths and cases by facility. Lawmakers and advocates have found that incredibly concerning, that it appears no one is keeping a spreadsheet or document tracking where people are dying in nursing homes. I was wondering if you can clarify, is the state tracking this information, and if so, how?
Yep. Dr. Dan?
So the way we've collected information from the beginning is after the executive order went in, we created an online survey, and that order required long-term care facilities to report within 24 hours of their knowledge if they had a new case or if there was a death. So that's the information that we get, and we look at that in 2-week intervals. What we're looking for is particularly, are there new cases that would signify a new outbreak in a facility, so that we can have our strike teams go in there and we can have our infection control processes in place. So while we have chunks of time, we don't have a cumulative list of every facility, all of their cases, and all of their deaths.
Nikki Kelly, the Fort Wayne Journal-Gazette.
Good afternoon, Nikki.
I had a two-pronged question. The first is, Dr. Box mentioned earlier that stores can mandate the use of masks, and I wanted to say that the state could also mandate the use of masks, and you guys chose not to. So why did you choose not to? And second of all, kind of a strange question, will employees that work in restaurants still be required to wear masks even if they don't interface with the public?
Well, I think employees that work in restaurants are still interfacing with potentially the food or the dishes or whatever that they're serving people. So I do think that they're continuing to wear masks is really important. The state could mandate the use of masks. Individual counties could mandate the use of masks. And that is something that we have discussed. There are individuals that, because of their hard of hearing, they require the need to be able to read lips. There are individuals that are very claustrophobic, and wearing a mask for them is something that would just almost cause a panic attack. So rather than mandating that, that is something that we've put as a personal responsibility for individuals across the state to do what is best and right for those that are around them.
Lindsay Erdody, the Indianapolis Business Journal.
Good afternoon, Lindsay.
Good afternoon, Governor. I wanted to follow up on some of the workforce development announcements from Friday. Some of those additional employer training grants that are supposed to be offered are supposed to be dedicated to women, minority, and veteran-owned businesses. Wondering if there's a specific amount attached to that or any sort of target. And then with the career coaching network that's supposed to be created, if there's any timeline on that. And again, that's supposed to target underrepresented populations and rural communities. So how do you plan to do that? And can you be a little bit more specific about what underrepresented populations means?
Yep. Fred?
Sure. First off, on the career coaching piece, we want to make sure that we're starting that as quickly as possible. So we're working on a rollout plan on that, and you'll be hearing a little bit more information about that. In terms of the specific dollars, we want to make sure that we target a minimum of $5 million, but we anticipate that it will be more than that.
Yeah, now, and having said that, Lindsay, we need help from our local partners to make sure that, as Fred said, that money's there for that reason. And we want to make sure folks are connecting with it, whether it has to do with cities and towns, that local 300, you refer to the 5 million of the 30, but there's another fund for 300 million for locals to expense through the CARES Act, thanks to our federal partners, to expense COVID-19 related costs or invoice them. And so please, 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 if you're a county or a city and you're having these expenses, don't wait. It's there now. We need to hear from you.
Meredith with WLFI.
Afternoon, Meredith.
Afternoon, Governor. So I have a question for you. So here in Tippecanoe County, the largest affected age group remains 20 to 29-year-olds. It accounts for 23% of our local cases. Is that something that's uncommon, since we talk about so much about how it's the older generation that's affected? Why do you think that it's a younger population where we live?
Yeah, it's the underlying health reasons and the
Are different.
Yeah, yeah. You want to talk about that age cohort?
So when we look at our cases in Indiana, about 30% of them are over the age of 60. But if we look at our deaths, 91% of them, or almost 92%, are over the age of 60. It is the younger population that is out there and feel themselves to be invincible and may have that great immune system that if they do get sick, their symptoms may be so minimal that they never stop to really pay attention to it. So it is not unusual for us to see the people that are out and about working, cohorting, or not cohorting, but visiting with their friends and engaging in those activities that we've been kind of asking them to social distance, and they don't always do that. So it's not surprising to me that that's your highest numbers. I would expect that.
Hope with the State House file.
Afternoon, Hope.
Good afternoon. I have a question for Dr. Box regarding something she had said earlier. Which 11 counties are transitioning the OptumServe testing sites to the mobile supports?
So for this period of time, Cass, Du Bois, Fountain, Jasper, Knox, LaGrange, Lawrence, Park, Perry, Steuben, and Posey.
Eric Berman, WIBC.
Hello, Eric.
Hello, Governor.
Just clarifying one thing, and then I have a broader question. I don't know that we addressed Marion County, and also wanted to throw in Lake and Cass. Are they still a week, and in the case of Cass, 2 weeks behind, or are they free to reopen if they so choose?
Free to open.
Okay.
Friday.
My primary question, I wanted to tie together a couple of earlier ones. It's been 12 days since the protests in India and elsewhere around the state. We haven't seen a surge based on that yet, not that it couldn't happen. I know you're not doing it right now, but is there a point where you would consider we've got data points, we've got large gatherings that have already taken place, we don't need to wait until July 4th to go to stage 5? And if not, why the full 3 weeks?
Well, Dr. Box can walk me through what 12 days means and 14 days means and 21 days means and 28 days means in terms of hospitalization rates and infections, et cetera. But we're just not there yet. We're doing this gradually. We're going up to, come Friday, 250 people. So every time that you double down, you gotta kind of wait and see. And we're not trying to skip a stage here. This has served us well so far, but you may want to give a more technical response to
your point is right. Not all individuals got infected on day 1. If they were going to get infected, they may have gotten infected on day 11 or 12. So there may still be another 10 days before we really see those infections show up, and that can be an additive thing. So I think that, Dr. Sullivan said it very well. We put these phases in place for a reason to begin with. We gave a lot of thought and a lot of time into it, and we are looking at the data to really make data-driven decisions, and so it's important to stay the course.
And if we're in a position where we can move it up a few days, 72 hours, we will. But if we're not, we won't.
That concludes today's briefing. Governor Holcomb's next briefing will be Friday at 2:30 p.m.
All right, you've been listening to Governor Eric Holcomb and state health officials announcing that they are advancing stage 4 of reopening from Monday of next week to Friday of this week. The governor says that's because the data is moving in the right direction. So stage 4 includes gatherings of 250 people or less, rather. Restaurants can now have 75% capacity, along with a number of other rules that have changed here. We'll have much more on that coming up at 5 and 6. You can also read about that on wishtv.com. All Indiana with you in about 40 minutes.
Not Ken Nunn. Ken Nunn is a real Indiana fighter who always fights for the big check. Just remember, the lawyer who cuts corners can end up costing you a lot of money. Call Ken Nunn.
Over $800 million collected for our clients.
Something was up a while back when I was walking and running a lot. The pain traveled from my feet all the way up to my knees, and then it started affecting my back. My head just wasn't in alignment. I sought the Good Feet store because I wanted to do something about it. Ever since then, I've been using the arch supports. No pain. These are my feet. They're worth it. I'm Joy, and that's my Good Feet story.
See for yourself with a free personalized arch support fitting at the Good Feet store.